I'm Lynn McGee, and I'm from the Office of Public Affairs at BMCC. I'm talking with Penelope Jordan, the Director of Health Services at BMCC, also known as Nurse Penny. And in addition to her many responsibilities as the Director of Health Services, which includes taking care of making sure that students all have their immunizations when they enter at the college, taking care of any health crisis that might happen on campus, and bringing BMCC into CUNY-wide health initiatives. On the weekends, Nurse Penny, as she is known, works in a level 1 trauma center at a public hospital in Brooklyn. Can you tell us what that's been like lately, Penny?
So it has been absolutely insane. Much different than what I was expecting during normal flu season. It's been just patients everywhere. We have been extremely busy. The hospital has seen a definite uptick in the amount of cases that have been coming in. We are, at one point we were definitely struggling with getting bed assignments, getting enough staffing to manage the increase in foot traffic, as well as hospital visits via ambulance. And it's just been really difficult to deal with this new reality.
Did the hospital have enough space for the patients that came in?
Initially we did not. We had whatever space that we had was taken up really quickly with the increasing amount of patients coming in. We were seeing patients in the hallway. We were seeing patients in rooms. We had a limited amount of negative pressure rooms, which is the norm. Most hospitals don't have a tremendous amount of negative pressure rooms. So we had to come up with some really quick solutions in order to manage the increasing number of sick patients that we had. And that was managed in a couple of different ways. Once patients were admitted, if they needed additional levels of care, we were able to repurpose some different spaces in the hospital and transform them into mini ICUs, which we were very successful in doing. We had to get additional staffing from agencies to come in. We have nurses from different states. We were able to move people around in order to get what we needed done.
Did you have enough PPE?
Initially, no. We had to be very careful with how we got our PPE. We were given PPE for that particular shift, but there was a definite lack of PPE initially. Then the hospital, I guess they improved their supply chains, and supplies started coming in, and we were able to manage our needs after a couple of weeks. It was difficult initially, but we were able to fix that.
Where did you get your mask?
Initially, I got my PPE from the hospital, but JCAHO, also known as the Joint Commission on Health, is our accreditation body, put out a statement that if nurses or other medical professionals wanted to bring in their own PPE, if they could purchase it from an outside source, then that was definitely allowed. And so I was able to purchase a partial face respirator from an online distributor, and that's what I've been using for the past couple of weeks.
What was the hardest part with the patients?
So the hardest part with the patients was knowing that, one of the hardest parts was knowing that they couldn't have visitors. And so it's very hard when a patient is coming in. Normally people come with their family members and they give information. But this time, family members had to leave their friends or, their loved ones at the door, and they had to trust us, people that they did not know, to provide care for their loved ones. And, a lot of the times, if, that person was dying or in a bad way, there's no family member at the bedside. There's no one saying, you know, to us what's going on. You know, family members are at home calling on the phone, and there's been some experiences where we've had to notify family members via phone that their loved one is deceased, which is rough. There's a process to dying, and we're not able to really facilitate that for a family member during this time due to, you know, due to the way the disease is transmitted. We don't want community outbreaks, and so unfortunately we have to limit visitors.
How do you, as a team in the ER, support each other through this really difficult time?
So what we've been doing is we've been doing huddles. So before the shift begins, we meet with the head nurse and the charge nurse. We discuss what's going on the unit, how many patients generally about how many patients we have in the unit. We get our assignments, we get our PPE, we get a quick bite. A lot of folks have been donating food, so sometimes there's food there, so we'll get a quick bite to eat, and then we begin our day. And that's when we find out what's going on the unit. We also find out what's going on with our colleagues who are sick. And, you know, if we need to pray, we pray. If we need to do some mindfulness, we do that, and then we begin our shift.
Would you say that you have one particular takeaway from the experience?
I think the biggest takeaway is just to appreciate everything that we have, the small things in life. I know New York is known for its cultural attractions and the museums and the theater, and, you know, we can't do that now. We are practicing social distancing, and, you know, I know it's very stressful for some because we are so accustomed to going out and about, but that's really the best thing for us. We're really, and at least I'm starting to see the curve flatten. We're not seeing a lot of foot traffic. We're not seeing a lot of people come in. We're still experiencing deaths of the patients that are admitted, but we're definitely starting to see a downturn in the numbers, as you know, that we've been taking care of. And so to that end, we all have to be mindful of the fact that this too will pass, and we need to understand that this is life right now, but it's not going to be something that we have to, it's not going to be the way that we have to live our life forever. And so my biggest takeaway request is just to, you know, ask people to be a little bit patient, and, you know, we'll get time to enjoy ourselves when we are in a better way.
Thank you so much for talking to me. I know that it's been a really stressful situation for you to be literally on the front lines with, and also returning to your office and maintaining your responsibilities as the Director of Health Services at BMCC is really impressive, and we're very impressed with you. So thank you so much.
Thank you for having me.